Hello everyone, myself Bhavani. Welcome to my YouTube channel MedChap. Today we'll discuss about the anatomy of the liver. First of all, we will see what is the location of the liver in the abdomen. As we know, the abdomen is divided into 9 regions. As we have discussed in the last video, liver is located in the major part of the right hypochondrium, greater part of the epigastrium, which extends to the left hypochondrium, and some part of right lumbar area. Now, location is right hypochondrium, epigastrium, left hypochondrium, that is extension, and some part of right lumbar area. Now we'll see the external features of the liver. Liver is basically wedge shaped, and this one is the 3D view of the liver. It has 5 surfaces. This one is the superior surface, this one is the anterior surface, this one is the inferior surface, this one is the right lateral surface, and the behind is it on the posterior surface, and it has one prominent border, that is the inferior border. Basically, liver has 5 surfaces and one prominent border, that is inferiorly present. This inferior border is present between the anterior surface and the inferior surface. Now the inferior border has 2 notches. Border has 2 notches. One is the interlobular notch or notch of the ligamentum teres. Ligamentum teres. And the second one is the cystic notch for the fundus of gallbladder. This one is a schematic diagram of the liver, and it is anteriorly faced. This one is the right lobe of the liver, and this one is the left lobe of the liver, which is divided anteriorly and superiorly by the falciform ligament and inferiorly by the ligamentum teres. And this one is the fundus of the gallbladder, and this one is the triangular ligament, and this one is the inferior border of the liver. Now we'll see the lobes of the liver. Liver has 2 lobes. One is the right lobe and second one is the left lobe, in which right lobe is bigger than the left lobe, and the right lobe and the left lobe are divided anteriorly and superiorly by the falciform ligament. Inferiorly by the fissure for ligamentum teres, and posteriorly by the ligamentum venosum. Now, right lobe presents 2 lobes, caudate lobe and the quadrate lobe. Caudate lobe is present in the posterior surface of the liver, and quadrate lobe is present in the inferior surface of the liver. Caudate lobe is present between the groove for inferior vena cava, which is in the right, fissure for ligamentum venosum, which is in the left, and Porta Hepatis, which is present inferiorly. to the caudate lobe. And in case of quadrate lobe, which is present between the fossa for gallbladder in the right and fissure for ligamentum teres in the left, and anteriorly the inferior border of the liver is present, and porta hepatis is present posterior to the quadrate lobe. Now we will see what is porta hepatis. Porta hepatis simply means gateway to the liver, that is the opening for the major blood vessels to enter and leave the liver. Porta hepatis is a deep transverse fissure and it is situated in the inferior surface of the right lobe of liver. Now it is lies between caudate lobe above and quadrate lobe below. Now we'll see what are the contents of porta hepatis. Here three structures that enters the liver, which are hepatic artery, which is both right and left, portal vein, both right and left, and hepatic plexus of nerve, and two structures that exit the liver are right and left hepatic duct and few lymphatics. Now the last relation of the contents within the porta hepatis. Posterior to anterior. First one is the vein, then artery, then duct. And with this, anatomy of liver is completed, and today's question is